What is schizophrenia? Schizophrenia is a long-term mental disorder of a type involving a breakdown in the relation between thought, emotion, and behavior, leading to faulty perception, inappropriate actions, and feelings. Now, I will go on to discuss with you the biological theories of schizophrenia, genetic contributors of schizophrenia, structural and functional brain abnormalities, neurotransmitter, psychosocial perspectives, cognitive perspective, cross-cultural perspective, and the treatment of schizophrenia. Given the similarity in the symptoms and prevalence of schizophrenia across cultures and time, biological factors have long been thought key to its development. There are 4 biological theories of schizophrenia. First, evidence indicates genetic transmission, although genetics does not fully explain who develops this disorder. Second, some people with schizophrenia show structural and functional brain abnormalities in specific areas of brain, which may contribute to the disorder. Third, many people with schizophrenia have a history of birth complications or prenatal exposure to viruses, which may affect brain development. Fourth, neurotransmitter theorists hold that excess levels of dopamine contribute to schizophrenia. New research also focuses on the neurotransmitter serotonin, GABA, and glutamate. Genetic contributors of schizophrenia. Family, twin, and adoption studies all indicate the presence of genetic component of the transmission of schizophrenia. Family studies. A psychologist, Irving Gutzman, compiled more than 40 studies to determine the lifetime risk of developing schizophrenia for people with various familial relationships to a person with schizophrenia. As the genetic similarity to a person with schizophrenia decreases, an individual's risk of developing schizophrenia also decreases. Adoption studies. Even when the child of a person with schizophrenia develops a disorder, it may not be due to genetics. A home with a parent with schizophrenia is likely to be a stressful environment. Approximately 10% of the children whose biological mother had schizophrenia developed schizophrenia or another psychotic disorder, compared about 1% of the children whose biological mother did not have schizophrenia. Twin studies. The study that assessed all twins born in Finland between 1940 and 1957 using statistical modeling estimated that 83% of the variation in schizophrenia is due to genetic factors. The results shows the concordance rate for monozygotic identical twins of 46% and concordance for dizygotic fraternal twins of 14%. Seymour Kitty and colleagues argued that the biological relatives of adoptees with schizophrenia were 10 times more likely to have a diagnosis of schizophrenia than were the biological relatives of adoptees who did not have schizophrenia. Structural and functional brain abnormalities. Clinicians believe that researchers have long believed that the brains of people with schizophrenia differ fundamentally from those people without schizophrenia. Positron emission tomography, computerized axial tomography, and magnetic resonance imaging or MRI These new technologies have shown major structural and functional deficits in the brains of some people with schizophrenia. Most theorists think schizophrenia as neurodevelopmental disorder, in which a variety of factors lead to abnormal development of the brain in the uterus and early in life. The brains of people with schizophrenia show reduction and abnormalities in white matter, particularly in areas associated with working memory. White matter abnormalities are present in individuals before they develop overt symptoms of schizophrenia, suggesting that they are early signs of the disorder rather than consequences of the disease process. The most consistent findings is a gross reduction in gray matter in the cortex of people with schizophrenia, particularly in medial, temporal, superior temporal, and prefrontal areas. Damage to the developing brain. What causes the neuroanatomical abnormalities in schizophrenia? Genetic factors and epigenetic factors seem to play a major role. In addition, these abnormalities may be tied to birth complications, nutritional deficiencies, and deficiencies in cognitive stimulation. Birth complications and prenatal viral exposure. Serious prenatal and birth difficulties are more frequent in the histories of people with schizophrenia than in those of people without schizophrenia and may play a role in the development of neurological difficulties. One type of birth complications that may be especially important in neurological development is perinatal hypoxia, or the oxygen deprivation of birth, or in the few weeks before or after birth. Prenatal viral exposure. Epidemiological studies have shown high rates of schizophrenia among persons whose mothers were exposed to viral infections while pregnant. For example, individuals whose mothers were pregnant during the famine in China from 1959 to 1961 had a twofold risk of developing schizophrenia compared to individuals whose mothers were not pregnant during of famine. Neurotransmitter. The neurotransmitter dopamine has long been thought to play a role in schizophrenia. The original dopamine theory was that the symptoms of schizophrenia are caused by excess levels of dopamine in the brain, particularly in the prefrontal cortex and in the limbic system. This theory was supported by several lines of evidence. First, drugs that tend to reduce the symptoms of schizophrenia is the phenothiazines or neuroleptics, block the reuptake of dopamine, reducing the functional level in the brain. Second, drugs that can increase the functional level of dopamine in the brain, such as amphetamines, tend to increase the incidence of the positive symptom of schizophrenia. Third, neuroimaging studies suggest that presence of more receptors of dopamine and higher level of dopamine in some areas of the brain in people with schizophrenia than in people without disorders. Kenneth Davis and colleagues in 1991 proposed a revised theory that suggests that different types of dopamine receptors and different levels of dopamine in various areas of the brain can account to the symptoms of schizophrenia. First, there may be excess dopamine activity in the mesolimbic pathway, a subcortical part of the brain involved in the processing of salience and reward. Second, there may be unusually low dopamine inactivity in the prefrontal area of the brain, motivation and organization of behavior. Psychosocial perspectives. Although schizophrenia is strongly linked to the biological factors, social factors can influence its onset course and outcome. Social drift and urban birth. People with schizophrenia are more likely than people without schizophrenia to experience chronically stressful circumstances such as living in impoverished inner-city neighborhoods and having a low-status occupations are being employed. Because schizophrenia symptoms interfere with person's ability to complete education and hold a job, people with schizophrenia tend to drift downward in social class compared to the class of their family of origin. Several studies also have shown that people with schizophrenia and other forms of psychosis are more likely to have been born in a large city than in a small town. Does stress of the city lead to psychosis? E. Fowler Torrey and Robert Buchan argue that the link between urban living and psychosis is due not to stress but to overcrowding, which increases the risk of pregnant woman or a newborn will be exposed to infectious agents. Stress and relapse. While stressful circumstances may not cause someone to develop schizophrenia, they may trigger new episodes in people with disorder. One major stressor linked to an increased risk for episode in schizophrenia is immigration. They may be faced financial stress, particularly in the education they receive in their native country isn't recognized in the new country. Schizophrenia and the family. Historically, theorists blame schizophrenia on mother. Early psychodynamic theorists suggested that schizophrenia results while mothers are at the same time overprotective and rejecting to their children. Gregory Bateson and colleagues argued that parents, particularly mothers of children who develop schizophrenia, put their children in double bind by constantly communicating conflicting messages to their children. Express emotion is the one factor in family interaction that research shows is associated with multiple episodes of schizophrenia. Family members who rate particularly high on expressed emotion are themselves more likely to have some form of psychoanalytic. Cognitive perspective. Aaron Beck and Neil Richter suggest that fundamental difficulties in attention, inhibition, and adherence to the rules of communication lead people with schizophrenia to try to conserve their limited cognitive resources. One way they do this is by using certain biases or thinking styles for understanding the overwhelming information streaming through their brain. Sign and symptoms of schizophrenia. Delusions arrive as the person with schizophrenia tries to explain strange perceptual experiences. Hallucinations result from a hypersensitivity to perceptual input coupled with a tendency to attribute experiences to external sources. Rather than thinking I'm hearing things, the person with schizophrenia, someone is trying to talk to me. This cognitive conceptualization has led to cognitive treatments for people with schizophrenia. Cognitive therapies help patients identify and cope with stressful circumstances associated with the development and worsening of symptoms. Treatment of schizophrenia. Comprehensive treatment for people with schizophrenia includes medications to reduce psychotic symptoms, therapy to help people cope with consequences of the disorders, and social services to support community integration and to ensure the access to the resources they need to participate in daily life. Biological treatments. Physicians have performed brain surgery on people with schizophrenia in an attempt to eliminate the part of the brain causing hallucinations or delusions. Insulin coma therapy was used in the 1930s to treat schizophrenia. Electroconvulsive therapy or ECT was also used to treat schizophrenia until it became clear that it had little effect. Several other antipsychotic drugs, also called neuroleptics, have been added to the arsenal of treatments for schizophrenia. Typical antipsychotic drugs. Jean Delay and Pierre Diniker found that chlorpromazine, one of the class of drugs called the phenothiazines, calms agitation and reduces hallucinations and delusions in patients with schizophrenia. Other classes of antipsychotic drugs introduced after the phenothiazines include the butyrophenones such as Haldol and the thioxanthines such as Navain. These drugs have significant side effects that causes many people to want to discontinue their use. The side effects include grogginess, dry mouth, blurred vision, drooling, sexual dysfunction, visual disturbances, weight gain and loss, and depression. One serious side effect is tardive dyskinesia, a neurological disorder that involves involuntary movements of the tongue, face, mouth, or jaw. Atypical antipsychotics seem to be more effective in treating schizophrenia than the neuroleptics without the neurological side effects of the latter. One of the most common drugs is clozapine. It's helped many people with schizophrenia who never responded to the phenothiazines, and it appears to reduce negative symptoms. Psychosocial and social treatments. Psychological interventions can help individuals increase their social skills and reduce their isolation and apathy. Behavioral, cognitive, and social treatments. These treatments are given in addition to medication and can increase patients' level of everyday functioning and significantly reduce the risk of relapse. Family therapy. Assertive community treatment programs provide comprehensive devices for people with schizophrenia, relying on the expertise of medical professionals. Cross-cultural treatments or the traditional healers. In developing countries and in parts of industrialized countries, the symptoms of schizophrenia sometimes are treated by the folk healers. Anthropologists and cultural psychiatrists have described four models that traditional healers tend to follow. Structural model. Healing involves reintegrating these levels, a change of diet, environment, and rituals. The second model is the social support, holds that symptoms arise from conflictual social relationships and healing involves mobilizing patients. Persuasive model suggests that rituals can transform the meaning of symptoms for patients, diminishing their pain. Last model is the clinical model. The faith the patient has in traditional healer to provide a cure. Cross-cultural perspectives. Different cultures vary greatly in how they explain schizophrenia. Most have for the disorder, including the general idea that it runs in families. Intermingled with biological explanations are theories that attribute the disorder to stress, lack of spiritual, and a family dynamics.